How are spinal metastases treated? The first aim is to confirm the diagnosis, and once there's a degree of certainty about this, treatment can proceed. There are a number of treatment options for spinal metastases, and often a combination of treatments is used. It's important to define the goals of treatment first. These may include relieving pain, reducing the amount of pressure on the spinal cord, or correcting any instability. The broad aims of treatment relate to mobility and function. You want to keep patients mobile, you want to keep them out of wheelchairs, you want to keep them in control of their bladder and their bowels, and you want to keep them as independent as possible. A range of treatment options exist, and these include surgery, they include radiotherapy, they include vertebroplasty, and they include stereotactic radiosurgery. Standard radiotherapy may be an option for many patients, but some tumours such as melanoma and renal cell carcinoma can be very resistant to this. Surgery may be done to relieve pressure on the spinal cord or the nerves and to stabilise the spine. Stabilisation is usually done with a combination of rods, screws and cages. Often surgery itself can be a major undertaking. Vertebroplasty is a good way of relieving pain in some patients with spinal metastases. Vertebroplasty can be done as a day procedure without an open operation, but is sometimes done in conjunction with a more major surgical procedure to stabilise the spine. Stereotactic radiosurgery can also be used in combination with open surgery. There is some evidence that early surgery offers the best chance of preserving mobility and function. There are some studies which show that early surgery as opposed to radiotherapy can offer a better outcome, but there are also other studies which suggest that this may not be the case. It's important that treatment's individualised and that each patient's characteristics, including their tumour and a whole pile of other factors, are taken into consideration. There is emerging evidence that stereotactic radiosurgery can be of benefit in the treatment of spinal metastases. If this treatment option is available, it's definitely worth considering and should be discussed with your specialist.